Well, by happenstance, we needed to develop a plan at my previous facility. It was part of the Providence system in Torrance, California, and we thought we were a little behind the eight ball in terms of our preparation with mass casualties. We had a response plan that would take a good half an hour to an hour to gather all of the equipment and supplies that we needed to respond appropriately, which led us to develop a process that we would be able to rapidly deploy supplies, equipment, create surge space, and include the staffing into that process. When we started to put our heads together to come up with this plan, we dubbed it 15 till 50, or 15 minutes until 50 patients. We were able to get some supplemental funding through the Hospital Preparedness Program grant funding. And because it was built with HPP funds, there's no copyright, there's no trademark, there's no cost to facilities to implement this, which really makes it that much more special. That this is not a sales pitch, it's not but just sharing a best practice that any size facility, even clinics have utilized this, could implement in their facility to perhaps put them in a better place and perhaps save a life. That is truly the ultimate objective here after a disaster.
You'd think with hospitals dealing with emergencies for so many years, this would have already been around. But like everything, it's got to be invented. So it must have been bubbling up inside you for some time. What inspired you to really create the program? Was there some kind of moment or event that just sparked the idea?
My hospital was located equidistant from the Port of Los Angeles and Los Angeles International Airport. We had received a call over our radio that there was a cruise ship explosion in the Port of Los Angeles and anticipate 2,500 victims.
Wow.
Right? So that, needless to say, got things mobilized. Since I was the only one in the hospital at the time that was savvy to the plan, spoke with the house supervisors to activate this. And I grabbed two of our emergency medical techs that happened to be working on the floor that day to deploy the equipment that we had just staged a couple of weeks prior to test this process. And we were, with the three of us, with only one person that had been trained in this, myself, we were able to get all of the equipment supplies set up in under 20 minutes. And we were able to establish a mass casualty treatment area to be able to receive these victims. One, it validated that it works. Two, it could be set up in a very short period of time. And with absolutely no training for the other staff, we were set up in 20 minutes. That's pretty impressive.
So I can imagine that people in healthcare who are listening really understand all this, but what about those folks who are not? Is this program adaptable to other industries as well?
As a matter of fact, it is. We've utilized this and helped implement this in a couple of warehousing facilities. I've helped a couple of our local schools to implement this so they have a mass casualty incident response to be able to triage, get these folks some immediate care before the EMS, emergency medical services, would be able to assist them. And in California, dealing with earthquakes or dealing with larger events, this could be impacting more than just one school at any given time, which means that would require a whole lot more support from our EMS community to assist them. So at least there are tools in place that they can respond and hopefully stabilize whatever injured victims they may have to be able to get them transported to the hospital. If you're looking to obtain any information, you can go to RAPEM, WRAPEM.org, and go to the Mass Casualty Incident tab, and you'll be able to download all of the planning guide, the training materials. There's video, there's sample files, there's equipment lists. It's there to set you up for success.